Welcome to Case of the Day. I'm Dr. Croley, and today we're going to change our focus a little bit. And we're not going to be discussing an actual patient or case of the day. Today we're going to be discussing something very passionate that I feel strongly about, and that is what's going to happen to healthcare, or what is going to be the future of healthcare in America. What I'm going to tell you, probably you're not aware of. In fact, probably even most physicians are not aware of. And so this is going to be probably shocking information to a lot of you. So, what's wrong with healthcare? What's the problem with healthcare? And this isn't going to be a bash against the Democrats only or the Republicans only. It's going to be a bash on both of them. Neither one has a program that is worth anything as far as healthcare is concerned. If we listen to the Democratic side, they want the government to run healthcare. And what does that mean? So we already know what that's going to look like because we can look to Europe and see what that's like. I've been to Europe. I know what it's like firsthand. It's going to be a decrease in access to healthcare. It's going to be a rationing of healthcare. And that's what is going to happen if the government chooses to run healthcare, which they're trying to do. The Republican side wants to turn healthcare over to the insurance companies. And what are the insurance companies going to do, things such as HMOs? What do? They're going to ration healthcare because they want the dollars to stay in their pocket. So it doesn't really matter whether the Democrats are in charge or the Republicans are in charge. Both ways, whether it's insurance or the government, they're both going to ration and limit access to healthcare. They are making huge mistakes about the policies and decisions they're making. You know, it's like, who knows what member of Congress or what member or staff member is writing all these rules about health care. I mean, it could be Joe the plumber. There's no expertise. How can someone who's not a medical professional make decisions on policies about health care should be run? I'm sure Joe the plumber can do a great job in doing my plumbing for my house, but I don't want him designing the plumbing for my body and how it's going to be taken care of. So that's one side of the issue is that neither side has done what they should do, which is if they were really smart, they would put together a panel of not just an academic doctor who doesn't see patients every day or who has a degree in epidemiology, but real doctors who are in the trenches seeing patients all day, every day, because we know the mess it is. And we know things that we can do to solve that mess. But no one listens to us. So, that's one aspect. The next aspect, and you may know something about those things, but the next thing you don't know about. And this came from Obama's stimulus plan. Not from Obamacare, that's a totally different subject. We're not going to discuss that today. This is about the stimulus plan. So in the stimulus bill, there was a provision in there that all doctors and hospitals need to use electronic medical records. And at first glance you say, what's the big deal about that? And in actuality, there are some good things about electronic medical records. One is a computer now has the record and it's actually legible versus my handwriting, which isn't. We can't even read our own handwriting, doctors. So, I mean, that is a good aspect of electronic medical records. And the other good thing is electronic prescriptions. That is, we now do most of our prescriptions through a computer into the pharmacy, and now there's a check and balance in the computer system about one drug could react to another. And let's be honest about it, guys, you don't even know what medicines you're on. Now, I don't know what percentage of people who come into my office, but they don't have a clue of what medicine they're taking. So if I prescribe something, I don't know if it's going to be adverse effect from what you're already taking because you don't know. But that computer system of the medicines does know that. So that is a great thing about electronic medical records and e-prescribing. What's the bad parts? Well, for one thing, they're very expensive. And two, the companies who've designed these have done a very bad job in designing them, and they're very inefficient. They slow a doctor down, and maybe some of you have been to a doctor who has an electronic medical record, and instead of him or her talking to you, they're on here typing on the computer trying to put your record in. So, that's one bad aspect, but that's still not down to the point I'm going to tell you about and what's so important. when that bill passed, it set up a committee called the HIT Committee. The HIT Committee was in charge of writing all the rules and regulations about, quote, meaningful use of an electronic medical record. Well, as soon as you turn over to the government to describe or describe meaningful use of something, it's thousands of pages. So now doctors are having to deal in hospitals with a huge volume of what practicing medicine is with an electronic medical record in a, quote, useful way. There's not, unless it's changed recently, there's not one single physician on that committee writing how doctors are going to practice medicine. It's ridiculous. And they report to no one. That is, there's no congressional oversight. They don't report to anyone. They can write anything they want to write and do or say anything they want in their committee. There's 3 stages to, quote, meaningful use of electronic medical records. Stage 1's already been implemented. So doctors are now reporting to the government what your height, your weight, your body mass index, whether you smoke, you drink, all these different factors that we now report to the government. So they're going to start tracking so they want to become doctors now, the government does, because they're going to run their own study about health. Stage 2 is beginning ready to be implemented, and that's still continually more reporting. So now doctors are required not just to try to take care of you in the best possible way they can, but we now have to do all this reporting and tracking of all these different things that this committee's decided we need to do. Stage 3 has not been written yet, but at least what they're proposing to do in stage 3, and this is where we really get down to what's going to happen to healthcare unless something changes. Stage 3 is after they've collected all this data, now the government's a medical expert. Now the electronic medical record, once you put in a diagnosis code into the medical record, it's then going to print out a treatment protocol for that diagnosis. Well, who's going to get to choose that protocol? Well, the government's going to choose what those steps are. And so now they're going to know. Let's just take, for example, Mr. Jones goes into a doctor's office 3 or 4 or 5 years down the road, because there's going to be no vote by Congress that this is going to happen. There's going to be no vote by you, the public, that this is going to happen. You're just going to go into a doctor's office one day in the next few years, 3 or 4 maybe, and you'll go in and say, "Doctor, man, my hip is just killing me. I'm having trouble walking. I need to do something about this." Doctor says, "Okay, degenerative hip," and out prints a treatment protocol for your degenerative hip. Not that the doctor thinks you probably need a total hip done, but because now the medical record knows you're 71 years old and you have 3 cheeseburgers a week and you weigh 260 pounds and you had a stent put in your heart last 6 months ago, and all these health factors, and instead of it printing out that you need a total hip done, it prints out you get a wheelchair. So that's where stage 3 is going to change how healthcare in the United States is going to be done. Through electronic medical records, the government's going to dictate what your healthcare is going to be, and no one knows it's happening. Very few people know it's happening. So, if you think this is something that you're not really happy about, then I strongly and passionately encourage you to tell everyone about this video and have them see it, and email all your friends to tell them to look at it. And then don't stop there, but then email your congressperson and your senator, or now this is election time, this is a great time to do this. If you have a candidate who's running for the first time, call their office and find out what are they going to do about this committee who is just running rapid on deciding how medicine is going to be practiced in this country. So I encourage you to please, please, if you care about your health care, contact these people and make your voice known that you want doctors in charge of your health care, not politicians, not people who are untrained making decisions on how health care is going to be done. And so with that, well, next time we get back to Case of the Day, it's going to be back to regular patient care and about an interesting case. So please do this. Please try to make a difference for your health care, and may God bless you with healthy eyes and great vision.